Welcome to Hibbert Health. Dr. Yanagisawa, thank you so much for joining me today. I'm so glad to have you here.
Yeah, thank you so much to invite me. Very honored for me. Thank you.
Oh, it's great. Thank you. Dr. Yanagisawa is a medical doctor and PhD. He is president of the International Society for Orthomolecular Medicine. He is the leader in intravenous vitamin C education and treatment in Japan, and was notably inducted into the Orthomolecular Hall of Fame as the pioneer in intravenous therapy in Japan. Dr. Yanagisawa received his medical degree and PhD at Kyorin University School of Medicine. He is a professor in clinical cardiology. Dr. Yanagisawa is past director of the International Education Center for Integrative Medicine in Tokyo. He is a fellow of the American College for Advancement in Medicine and board certified in chelation therapy. Dr. Yanagisawa has delivered countless lectures at international conferences, has authored over 145 scientific papers in English and Japanese, and published several books on cardiology, chelation, nutrition, and IV vitamin C for cancer. Dr. Yanagisawa has received several prestigious awards honoring his academia and health-oriented work. Dr. Yanagisawa, this is so wonderful, all of your accomplishments. Can you give us a brief introduction to the International Society for Orthomolecular Medicine, of which you are president?
Yes. So orthomolecular is a very unfamiliar word. Orthomolecular is a term that comes from ortho, which is Greek for correct or right. So orthomolecular means right molecule. 2 times Nobel Prize winner and molecular biologist Dr. Linus Pauling coins the term orthomolecular in his 1968 article of the journal Science. So orthomolecular medicine describes the practice of preventing and treating disease by providing the body with optimal amounts of substances which are natural to the body. Intake of essential nutrients such as vitamins, minerals, and amino acids from supplements will prevent and treat illness, leading to an ideal health condition for whole generations. International Society for Orthomolecular Medicine, ISOM, headquarters is located in Toronto, Canada. I have been the chairman of ISOM since 2012. At present time, 23 countries around the world, including Canada and the United States, Japan, are registered with ISOM. In May 2021, next year, the 50th annual meeting will be held in Toronto.
Dr. Yanagisawa, can you please elaborate on what orthomolecular medicine encompasses in nutritional health and medical treatments?
Okay, so orthomolecular medicine is a nutrient treatment in the variety of the disease from cancer, immune disease, and also the cardiovascular disease, and also the neurodegenerative diseases such as dementia. So what's the difference? Usually nutrients therapy is good for the maintaining the health, but approach of the orthomolecular medicine is more higher level of the nutrition therapies. Okay, nutrition therapy for prevention and also curing of diseases, especially chronic diseases. We use sometimes very high dose nutrient therapies. For example, vitamin C for cancer. Usually it's vitamin C is essential nutrients, and we need 1 to 3 grams of the vitamin C every day. But for example, in cancer patients, we treated the cancer patients using 50 to 100 grams of the IV treatment. And also, it's quite sometimes very mega dose of the nutrients. Another example case is psychiatric disease schizophrenia, depressions, and anxiety. We use a vitamin B3, niacin, and B6 and vitamin C combination, sometimes 10 to 100 times higher dose. And this is quite effective for such patients. Trust me, sometimes high dose of the exact nutrient is very effective. This is not a maintenance therapy. We try to cure a patient using right molecule nutrients and sometimes high dose nutrient therapies. That is quite different from the ordinary nutrient therapies. People believe that the nutrients is to maintaining the health, but we would like to cure the diseases using sometimes high dose and right nutrients therapies. Modern medicine has very limited because most of the drug has adverse reactions. So I think nutrient therapy is sometimes very effective in chronic diseases and should be the first choice for the treatment of chronic diseases. Because most of the nutrient therapy has very few side effects and should try to fast in the nutrient therapy. But if it does not work, you can choose medicine. I educate doctors, more than 2,000 doctors, and also our group has 850 physicians who practice osmotic medicine and intravenous vitamin C and other therapies.
Thank you so much, Doctor. That's very informative. Please tell us about the activities of the International Society for Molecular Medicine for COVID-19.
Yes, new coronavirus infection, COVID-19, in 2019 has become a pandemic, spread all over the world, and our lives have changed. Since the beginning of the pandemic in January 2020, the International Society for Orthomolecular Medicine and Orthomolecular Medicine News Service have provided healthcare professionals and the general public with information on the prevention and treatment of COVID-19 using orthomolecular nutrition approach. In addition to gargling, washing hands, and social distance, we recommend orthomolecular nutrition therapy for the prevention of COVID-19. In the case with COVID-19 infection, we recommend high-dose vitamin C infusion therapy in addition to conventional treatments. Recently, many good results have been reported and various related clinical trials are being conducted in many countries. We first released topics to the public about COVID-19 January 26, 2020, beginning of the pandemic of the COVID-19. Vitamin C protects against coronavirus. And in this issue, we recommended 5 nutrients. So ISOM urges a nutrient-based method to prevent or minimize symptoms for future viral infection. The following inexpensive supplemental levels are recommended for adults against COVID-19. Vitamin C, 3,000 milligram or more daily in divided doses. Vitamin D3, 2,000 IU daily. But start with vitamin D, 5,000 IU per day for 2 weeks, then after reduce to 2,000 IU per day, because most of the people has a deficient of the vitamin D3.
Yes.
Also, zinc is very important. A nutrients of 20 milligram per day is daily. Magnesium, 400 milligram daily, and selenium, 100 microgram daily. February 2nd, 2020, we released news topics of the hospital-based intravenous vitamin C treatment for COVID-19 and related illnesses. I was in New York in February 2nd, and New York is very stable, and no one talk about the COVID-19. But 1 month later, everything's changed, horrible. But we released this news in very early phase of the pandemic, February 2nd. Information about COVID-19, preventing and curing using the nutrition therapies. March 3rd, 2020, we have the media conference in Tokyo.
So these are all media people meeting that you're speaking with?
All the people is medias. But unfortunately, only few media introduce our nutrient therapies.
Thank you, Dr. Yanagisawa, for reviewing that information for us. I know everyone will find that very interesting. Can you please talk a little bit more about the nutrients that you consider to be the most important for COVID-19?
Yes. I think the three nutrients, vitamin C, vitamin D, and zinc, are the most important and essentials. Those three nutrients reveal effects of the antivirus, antioxidants, immune modulating, and boosting. There are clear evidence for those three nutrients against COVID-19. The two studies were published in the last September. The different groups showed similar results, but the association between lower COVID-19 positivity rates and higher vitamin D levels remained significant. Also, the Spanish group shows that intake of vitamin D significantly lowered hospital deaths in severe patients. Maybe you know that when President Trump got COVID-19 in October, he received several medications, including vitamin D and zinc. Also, there are very interesting conversation with Jennifer Garner in the Instagram. Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Disease, he's very famous for COVID-19 controls. He told that he have taken vitamin C and zinc for prevention of COVID-19. So vitamin C, D, zinc is very cheap, safe, and very powerful nutrients against COVID-19. So please remember the word C, D, zinc. This is three nutrients, very cheap and very important. Okay.
Thank you, Dr. Yanagisawa, for impressing upon us how important those nutrients are. What kind of strategies and activities will the International Society for Orthomolecular Medicine be carrying out in 2021?
Almost 12 months have passed since the COVID-19 epidemic began, and we have accumulated a lot of experience and learning. Based on this, we must take action. COVID-19 will not disappear from us forever, I believe. And we will eventually have to coexist with COVID-19 and other novel viruses. We have to think about the next COVID-19, COVID-20 or 21, I'm not sure about. But this will happen in future. So health authorities, governments, and the industry have made enormous financial investments in the development of vaccines and antiviral drugs. The urgency to develop and test these therapies may distort our true understanding of their efficacy and safety. Viral mutations and genetic variants in the population are factors that undermines the potential of a single vaccine or antiviral drug. At International Society for Orthomolecular Medicine, we are convinced that protected population immunity in a health community is a way forward for human beings. During and post-pandemic health management is an important key. By reviewing lifestyle, in addition to optimal diet, exercise, sleep, good mental health, and taking nutrients such as vitamin C, vitamin D, zinc, selenium, magnesium, etc., necessary to prevent viral infection, people will have a good, healthy immune system. In this community, COVID-19 infections can be asymptomatic or with mild symptoms. People in this community can protect their. This is protected popular immunity. Protected popular immunity is not only effective against COVID-19, but also pandemics caused by the emergence of new viruses. Moreover, this strategy is realistic, practical, immediate, safe, and inexpensive. We are now also medicine in a new age. The ISOM, our society, and related societies and colleagues will promote make the communities healthier with the slogan of protecting population immunity. That is our next action of 2021 to the public.
That sounds very noble. I wish you all the best getting that information out there because it's essential information. Everybody wants to learn about nutrition and health and mental health and exercise. This fits perfectly with that whole framework of living a healthy lifestyle. So, just like you are what you eat, we're all personally responsible for our own health. And to have information like you've taken the time to give and to put out there to the public, the information is there. So, how people run with that will determine how long we are in this pandemic and what happens to us as time goes on, as we get challenged with other viruses or whatever might come our way. Thank you so much, Dr. Yanagisawa. Your information is vital, important. It's so much a part of our everyday life, and it should be. I hope this is very helpful for everybody that's listening to this video. And please subscribe to my YouTube channel so you can see new videos as they get uploaded, because I hope to bring forward more wonderful information like Dr. Yanagisawa has given us today. Thank you so much for joining me today.
Thank you very much, Jennifer. I'm very happy to talking with you.
I love what you're talking about and what you're sharing. I mean, it's phenomenal and it's so basic. And it takes basic, like you said, to that higher level. That's a higher level of health. And I give you so much credit for all the work you've done through your whole career. It's really impressive. Thank you so much for being there, for doing what you do, and for feeling comfortable to bring this forward with me to the world. Really is wonderful.